Hello everyone, welcome to AY Tutorials. Today we are going to study all the information about the asthma, like what is asthma, what are the signs and symptoms of asthma, what is the possible treatment and how to prevent the asthma. So without wasting our time, let's get started. What is asthma? Asthma is also known as the bronchial asthma. Is a long-term inflammatory disease of the airways. Asthma is a condition in which a person's airways they becomes inflamed, narrow and swell and produce extra mucus which makes it difficult to breathe. Asthma can be the minor or it can be interfere with the daily activities also, and in some cases it may lead to the life threatening attack. Uh, there are some key characteristics of the asthma, like on and off symptoms. There are certain symptoms which can be there. Then common symptoms include wheezing, shortness of breath, chest tightness and coughing. um, Asthma may cause difficulty in breathing. Then chest pain, cough, wheezing and the symptoms may sometimes flare up. Asthma can usually be managed with the rescue inhalers to treat the symptoms, like salbutamol drug is there, and controller inhalers are also there that can prevent the symptoms, which includes the steroids. And in severe cases, it may require the longer acting inhalers that keeps the airways open, like formoterol, then salmeterol, as well as some inhalant steroids. Global impact in 2019, asthma affected 262 million people worldwide. Types of asthma. Asthma can be classified based on the clinical patterns, including demographics, symptoms, and disease process. There are certain common types of the asthma. First one is the allergic asthma. It usually starts in the childhood, often linked with the personal or family history of the other allergic conditions. For example, asthma, allergic rhinitis, and food or drug allergies. So, this allergic asthma, it is also known as extrinsic asthma, and it is the most common type of the asthma which affects about half of all the people with the asthma. It is triggered by the exposure to the specific allergens which cause an immune system response in the airways. Then there are certain common symptoms of the asthma. These allergic asthma, which includes coughing, wheezing, shortness of breath, and chest tightness. But they specifically occur or worsen up after the exposure to the identified allergens. Then next one is the adult or late onset asthma. It develops in the adulthood even without a history of allergies, and it is more common in the women. So this adult onset asthma, it is also known as the late onset asthma. It refers to the asthma that develops for the first time in the adulthood, typically after the age of 20. While many people are diagnosed with the asthma in childhood also, and it's increasingly recognized that asthma can emerge at any point of the life, including middle age or even later. The next one is the childhood asthma, the leading chronic disease in the children. It is characterized by recurrent wheezing episodes, though not all wheezing indicates asthma. So, this childhood asthma is also known as pediatric asthma, and it is a chronic respiratory condition that affects the airways of the children. It's not a different disease from the adult asthma in the underlying mechanism, but children face unique challenges due to their developing lungs, smaller airways, and different exposure patterns. It's the most common chronic disease in the children and the leading cause of emergency visits, hospitalizations. Next one is the occupational asthma. It is triggered or worsened by the allergens in the workspace. Symptoms often improve when away from the work. So, this occupational asthma is a specific type of asthma that develops or is worsened due to exposure to the certain substances or the conditions in the workplace. It is distinct from the general asthma that might be aggravated by the work conditions, which is known as work aggravated asthma, or OA, is directly caused by the work environment. Here I have mentioned exactly what happens during an asthma attack. During an asthma attack, several changes occurs in the airways due to the inflammation. As we all know that there is the inflammation, so there are the certain changes in the airways. The muscle around the airways may contract, then airway tissues become the swollen, massive mucus is secreted, and these changes lead to the narrowed airways causing the symptoms like wheezing and breathlessness. Then common triggers, they are vary by the individuals. Viral infections may be there. Then allergens like pollens and dust are responsible for this asthma. Then food allergies are also there. Then air pollutants are there. Cold weather and poor medication adherence may also lead to the asthmatic attack. Then exercise and mental stress is also there. Here are some symptoms of the asthma. Asthma symptoms includes wheezing, shortness of breath, cough and chest tightness. Then distinct characteristics. So this wheezing, shortness of breath, cough and chest tightness, these are the primary symptoms. Then there are some other symptoms also, like worsen at the night or in the early morning, vary in the intensity over the time, which is triggered by common colds, exercise, allergens, weather changes, and some irritants like strong smells, smoke, or fumes. Here are some certain risk factors for asthma. So, while the exact cause of asthma isn't always clear, the certain factors increases the risk, like family history of asthma, especially the first degree relatives like parents and siblings. Then other allergic conditions like asthma or rhinitis. Then childhood or infancy events affecting the lungs, low birth weight and prematurity, respiratory infections, exposure to the environmental irritants, air pollutants, house dust mites and molds, chemicals, and being overweight or obese can be also the risk factors for the asthma. Here I have mentioned the preventing of asthma attacks. Strategies to reduce the risk of attacks includes follow your asthma action plan, that is AAP, and take the medication regularly. Then avoid the exposure to the potential triggers. Have a regular asthma control reviews with the healthcare providers. Use your inhaler with the correct techniques. For mothers, to lower the children's asthma risk, it includes avoid the tobacco smoke exposure during the pregnancy and the baby's first year. Choose the vaginal delivery over the C-section if medically appropriate. Then breastfeed your baby to boost their immune system, and avoid giving the antibiotics to the babies under 1 year unless prescribed by the doctor. Here we are done with the asthma. If you like this video, please like, share and subscribe to the AY tutorials. Thank you.